Hi students, in this module we shall be discussing about the approach to an injured child or a patient in the pediatric age group. Before moving on to the approach, we should know what is an adequate X-ray. An adequate X-ray is based on two parameters. In terms of views, it should have at least two views called the anteroposterior and the lateral view. Also, there is a rule of orthopedics in which it is mandatory that you should include a joint above and a joint below while you are requesting for an X-ray. So a X-ray having minimum two views, anteroposterior and lateral, covering the injured area as well as joint above and below is called an adequate X-ray. So an adequate X-ray should include the injured area and the joint above and the joint below, and should have two views minimum, AP and lateral. This confirms that your X-ray is adequate. Students, once you know what is the adequate X-ray film, you should also know that while ordering X-rays in an injured child, you should be ordering X-rays for both the sides for comparison. As the bone in children is made up of with various small pieces, it is quite common that one can confuse these small pieces to be the fracture themselves. Students, once we know that what fracture we have in our hands after assessing the X-rays, there are only two possibilities. One, the fracture can be displaced or it can be an undisplaced fracture. Displaced fracture tends to cause distortion of the limbs and they do not match the identical limb. To bring it back to the identical or anatomical position, we have to do a maneuver called as reduction. This initial reduction that is done at the time of injury or after the patient presents to us in the emergency room, we have to focus on two parameters or two principles of reduction. One is the length and second is the rotation. The length and the rotation should be brought back to as normal as possible. So a displaced fracture, initial reduction should focus on length and rotations. Once you have the limb initial reduction done, your limb should come back to the anatomical position. This limb also needs to be supported with the help of a splint or a slab till the time you plan for a definitive method of managing the fracture. So once you have got this primary treatment done up, slab, then there are two possibilities. Either you would be converting this slab into a cast if you are managing the fracture conservatively, or else you will be operating the child. In another scenario, you might continue your initial slab for the time of fracture healing and make it as a permanent way of managing the fracture. So either this slab could be continued until the 4 to 6 weeks till the fracture unites, and this initial slab can be your definitive way of managing the fracture, or this another scenario, this slab can be converted into a definitive conservative way like a plaster, or you can take up the child for surgery for definitive management of the fracture.